So today here we're working with Gianna. We're taking a look at knee pain with dancers. What we can see when we work with Gianna is that when she stands in what we call quiet stance, so just kind of like standing there, there's a lot of like hyperextension at that knee. So she has like a complete knee lockout, and there's a little bit of like backward bending because of how flexible she is. It's common with dancers. Obviously, dancers are flexible, and then what like happens over the course of time is the muscles become overly developed because they gotta work on the stability of that flexible joint. So there's different ways to stabilize the joint. So you have your active support system and your passive support system. Your passive support systems could be like your ligaments and just like the internal joint structure. The active support systems could be more related to the muscles and tendons and then how you move. So when it comes to dancers, cheerleaders, acrobatic people, you definitely have to be more aware of like how your body's positioned as you move to make sure that everything is in good alignment as you're completing the sport or the activity that you're doing. So what we see with Gianna's like legs is that she has like a lot of quad development, which again is like common in dancers and gymnasts. You can see that bow out, and then with the hamstrings, there's not as much like muscle tone as we'd like to see in terms of like a normal muscle balance. But the increased quad density allows her to be very like good and skilled at dancing. So in dances, it's not necessarily a bad thing to have this development, it's just like expected. So what we have to do with like rehab is to work on the single leg strength and building up the hamstrings to offset what's going on at the knee. When we take a look at the normal knee for an individual, you want to see a little bit of a knee bend. So that would be more of like a normal knee position. And what happens here is you unlock the knee so there's less pressure on your meniscus. And so if you're standing like this, you're engaging all your muscles around the joint to stabilize. When you hyperextend there, there's a lot more pressure on the meniscus on both sides. So over the course of time, that can just kind of like lead to potential like meniscal fraying or just an increase in the chances of patellofemoral pain syndrome. Because when your knee is hyperextended like this, the patella will float outside of its groove a little bit, and you rely more on the tendons on both sides to hold it in position as opposed to unlocking it and getting like a better contact area. But like I said, when it comes to athletics, sometimes certain muscles have to be overly developed to do what you want to do well. So what we're dealing with Gianna is that she has a little bit of an anterior knee pain because she's constantly standing like this. So part of the rehab process that we'll educate Gianna on is that when she's not performing is to practice like unlocking that knee and standing in quiet stance like that, and then working on her training regimen in the PT clinic to work on strengthening her legs so that she's able to better engage the quad and the hamstring in this position. Because when she's locked out, the quad doesn't really work all that well, and then you're relying just on the passive joint structure, so you're just relying on the ligaments and the joint structure to hold things into place. What we do when we have somebody that comes in with the anterior knee pain is we'll do what we call patella glides. So we'll kind of see how that kneecap tracks downward. So is it easy to push that kneecap down about like half its width? Can it move across like half to 3/4 of its width? And then can you move it laterally half to 3/4 of its width? And you kind of want to see how that patella sits. So if there's any variation in the optimal alignment over the course of time, if you're a dancer, you're going to be putting a lot of stress on that system, like in an unbalanced way. So one of the goals of PT is to work on balance, work on strengthening, work on flexibility, work on range of motion and pain control. So in her case, the kneecaps sit pretty well. They sit pretty well aligned in terms of doing the window test, but the kneecaps ride a little bit higher in the grooves because of the overly developed quads. So we call this is patella alta. So that kneecap, when she's working to do squats or lunges, that kneecap sits a little bit higher in the groove. So then that kneecap, when the knee bends, that kneecap's supposed to glide downwards. It's not going to glide downwards as well because of the resting position, it sits a little bit higher, so that just throws off the mechanics. And over the course of time, if you're a runner, if you're a dancer, and you're putting a lot of load on that knee, it just really creates a ton of like irritation in there. So a couple of things that we typically do in the clinic is teach foam rolling. We teach quad stretching. We'll use a massage gun. We'll use some like biofreeze to kind of calm things down. Some Tiger Balm. And then what we want to do also is to teach her some strategies for kinesiotaping or patellotaping to keep that knee in a better position.
Thank you so much for having me.
And just by teaching her to do the patellotaping on her own, you know, that means like less visits in the clinic. She's more educated on what's going on, and then she can kind of continue on with like being a highly active dancer without having to slow down. So during practice, we would say, okay, wear the kinesiotape or wear the patellotaping throughout the entire practice, wear it throughout the day. But when you perform, you can take it off just to kind of, you know, pay attention to the cosmetics and, you know, the overall performance and the overall show.